The city of Toronto could soon face a major disruption as QP Local 79, which represents 30,000 city workers, has taken a significant step towards a strike. With contract negotiations stalled, essential city services from public health to childcare and recreation could be impacted. Joining me now to break down what's at stake and where negotiations stand is Naz Yadolahi, president of QP Local 79. Naz, thank you so much for joining me.
Thanks for having us.
Awesome. So, the union has warned of massive disruptions if a strike occurs. What are some of the most critical city services that would be impacted?
A lot, and I don't think people quite realize how much work Local 79 workers do, but I will just give you a few examples. Building inspectors, childcare workers, recreation facilities, public health nurses, and inspectors. So these are folks who ensure that the restaurants you're going to are getting a green pass that everybody wants to see before they walk into a restaurant. City planners, permits, chemists, and these are people who ensure that the water that's coming out of our tap is clean drinking water. Shelter workers, 311 call takers. 311 is an extremely busy service. So residents of Toronto who need to report or ask questions about any city operations, call 311. Employment social services is where people get their social service checks at the end of the month. So that's just a few of the over 45, 50 divisions that we operate in the city of Toronto.
Wow, that's a lot. That definitely, especially right now when you're talking about 311. I was just telling people at the earlier in the show about if their driveway gets blocked and clogged with snow, that they can call 311, and hopefully it's going to get resolved by Monday. But what you're saying is not so fast. That they might be on strike.
No, a strike is weeks away, should the city choose to move us in that direction. But yeah, we do a lot of work across the city, and certainly the people in the city would feel the impact should we move towards withdrawing our labor.
Wow. So the city has offered a 4-year wage increase, similar to the deal accepted by QP Local 416. So why is this offer not sufficient for Local 79 members? What's different?
416 is a very different local, and 416 accepted a deal that they felt met the needs and demands of their workers. Local 79, our makeup is different, and as I outlined, the work that we do is vastly different. Our makeup is 70% women, 60% racialized people, and I think the most significant thing is that we have thousands of workers who are earning minimum wage, and those are things that 416 doesn't have to face. And so when you're looking at a contract, it has to meet the demands of your particular workforce. And really what the city is doing is comparing apples to oranges. What they're not saying is, look at the contract we gave ATU, which represents TTC workers. They're not comparing us to anyone else. But there's been this historic idea that Local 79 and 416 are similar and somehow bound. There's lots of other organizations and unions that the city negotiates with that they don't talk about.
Wow, geez. So, how does the issue of chronic understaffing affect the quality of city services, and what solutions is the union advocating for?
The quality of city services has declined massively over the past couple of decades, and it is exactly because of recruitment and retention, which, as you just pointed out, it results in understaffing. Recruitment and retention are very intimately linked to wages and the environment in the workplace. So when you don't have a positive working environment and you're not paying people enough, people will not work for you. They will go somewhere, probably closer to home in another municipality, where they're getting paid more and being respected for their work. But when we're talking about chronic understaffing, let me put this into perspective. Our long-term care homes have over 500 vacancies. The ratio of resident to nurse is as low as 1 to 60. 60. So one nurse has to be responsible for 60 residents at any given moment. So when you're looking, and in addition, we've talked a lot about our ambulance communication center, people who pick up the call and you say, they ask you fire, police, or ambulance. And we ask for ambulance. we don't want to be waiting on the phone until that person picks up the phone and gives us life-saving instructions until ambulance arrives. That particular division has seen retention as low as 30%. And these are services that impact everyone in the city of Toronto. You don't want your elderly parents in a facility that is being severely understaffed, because then you really have to think about what is the quality of care that I'm receiving. And if I'm being put on hold for 5 to 7 minutes for someone from Ambulance Communication Center to be able to pick up the phone, it's a matter of life and death. And I really think the city needs to look at its priorities and what they've been doing for the past 10, 20 years to create such a crisis.
Yeah, no, you're absolutely right, Naz. I mean, those are huge issues. And, I know we've spoken weeks and maybe months ago on this show about people having to wait too long for those calls to be answered. So it is critical. Naz, thank you so much for joining us this morning.
Thank you.
Thank you.